All right, so let's officially begin. Good evening, everyone, to all of your bright, shining, smiling faces. I am so excited to be here this evening. My name is Dr. Bridget Bronner, and I am currently chair of the National Advisory Committee for our ANA SAMHSA Minority Fellowship Program. And I am super thrilled and excited to welcome you to our 2021 Virtual Intensive Summer Institute. For those of you who were able to join us for our winter institute that we had, you know that we had a great time despite having to be virtual. And so I'm excited to announce that we're going to do it again in the summertime. We have a great program set up for you, some amazing dynamic speakers. And so I'm really looking forward to the conference activities that we're going to get into. But then I am also most excited that this evening we get to celebrate our graduates. So can you use your React buttons to either clap or send up the little celebratory, confetti that goes up, put things in the chat if you have a particular graduate that you would like to shout out. But this is a major accomplishment for those who are coming to the end and have completed their master's, PhD, and DNP programs. And so I am thrilled to be able to honor and celebrate them this evening. And I also want to commend all of you. So our alumni who are on, our current fellows, our National Advisory Committee members, I think many of us have just sort of been running on E. There's a lot that's been going on, but you're continuing to show up for yourselves, for your families, for your classes, for your patients, for your research, right? Like you're being pulled in so many different directions and you're still finding a way to not miss a beat, but be well in the process. We don't want to get into that narrative where we're just doing right for the sake of doing and not taking care of ourselves. And so clap it up for yourselves. I honor each of you for making it, right? For continuing to not only survive, but also thrive in these very challenging times. And I want to acknowledge, we live in a global context. So the things that are going on in Afghanistan right now, things happening in our own backyards, in the cities that we live in, the world is just continuing to crumble and fall around us. And as disheartening and as discouraging as that is, my heart still gets glad and warm that we have people like you who are in behavioral health, right? Who are providing care, culturally sensitive and relevant care to those who need it most, leading investigations and synthesizing knowledge so that we can truly transform the care that individuals receive who have been exposed to trauma, or who are struggling through the pandemic and having a hard time in multiple ways. And so while doom and gloom could lurk all around us, I'm just really excited that each of you are here and that you are going to be and already are part of the solution for the challenges that our world is facing. I could get on an entire soapbox about how excited and thrilled I am to have you all in the field of psychiatric mental health, but I do not want to delay our program. And so this evening, I am super excited. We have Dr. Ernest Grant, who is president of the American Nurses Association. And so he is going to give us some greetings and remarks. And then we have a treat. He is our keynote address speaker for the evening before we get into the award ceremony and the graduation. And so with that, Dr. Grant, I would like to turn it over to you. And again, thank you. You are so busy. And so we as the MFP truly appreciate you giving of your time to be here with us this evening.
Well, thank you very much, Dr. Bronner. It's indeed an honor and a privilege to be with you this evening. And I am speaking to you from what I like to call now ANA's satellite office. It's about 275 miles away from Silver Spring, Maryland, but nonetheless, we are here. So we're speaking to you from beautiful downtown Chapel Hill, North Carolina, where it's still 91 degrees and the potential for thunderstorms this afternoon or this evening. But nonetheless, I'm extremely excited and delighted to be here with you. I would like to just take a moment to try to share my screen with you as we go through, and hopefully everyone can see that. Please nod yes or no. Yep. Okay, great. So we sort of will combine both my greetings and your keynote address into the same. So first of all, on behalf of the American Nurses Association, I do want to take this opportunity to extend my sincere greetings and congratulations and best wishes to the 2021 Minority Fellowship Program graduates, and this year's award recipients as well. It's an honor to be with you on this this virtuous and joyous occasion. And during these very turbulent times, it has been inspirational to see what innovative ways that we have found to be able to connect, to collaborate, and most importantly tonight, to celebrate our achievements. We value each of you for your expertise, your commitment, and contributions to eliminating health disparities and ensuring health equity for diverse populations. As we gather here tonight to celebrate your achievements, I hope that you're willing and ready to spread your wings as you start your leadership journey. The work and the challenges that you have ahead of you will be immense, but I have no doubt that you are ready and able to meet those challenges. And speaking of leadership journeys, if you will grant me just a few moments to talk about my own leadership journey, and I hope that it may be able to impart some words of wisdom to those of you who are graduating tonight. As I'm sure that probably it was the same for you as it was for me, that you didn't see yourself as a leader when you started down this path, but I'm sure that probably someone saw leadership skills in you that you didn't know were there. But those skills got nurtured, and the next thing you know, look at you. We know that this just didn't happen overnight. It probably started out by your being asked to serve on a committee, probably at work, perhaps at an organization that you belong to. You may look back and realize that you were probably duped into serving on that committee because no one else wanted to. But the difference, though, was that you brought in fresh, new ideas. You took the committee to the next level. You achieved or exceeded goals that were set. And then the next thing you know, you're being asked to serve or even chair on the next committee because you did such a great job. And then the next thing you know, your reputation begins to soar, and others want you to serve on their committees or on their boards. So I'd like to take the opportunity to talk about the importance of serving on boards and committees. For me, it did start out with serving on a couple of committees at work, and then through my state nurses association. And I probably did get duped into, when you're new and you're being told that, oh, you should chair the membership recruitment committee. But we had some great success. Actually, we increased the membership by about 10% during the 2 years that I served on that committee. But that was the beginning of my journey. And the next thing I know, I'm serving on not only the state nursing committees, but then also committees within ANA and committees within my chosen profession as well. But all boards begin to benefit from the unique perspective that we as nurses have to bring or to achieve the goals to bring about improving health and the efficiency, and also to have the effect on healthcare systems at the local, state, and national level. The benefits of joining and being a member of a board is extremely important, and it also gives you a different perspective when you serve on a committee that perhaps is outside your profession or outside of our zone, if you will. I had the pleasure of serving as chairman of the National Fire Protection Association, and you're probably going, what organization is that? You may not know it. Yes, it involves firefighters, and as you can see behind me, when you do see me on the live screen, you notice I have a couple of fire helmets on my bookcase, and that's because I was a volunteer firefighter. But this particular organization, they not only served firefighters, but they also set codes and standards for pretty much just about everything that you touch. That's maybe a lamp, it may be a door, it may be boarding an airplane, it may be even going up and down stairs. Believe it or not, there are standards and codes about going down the stairs. But the benefit was that I was able to bring my nursing knowledge and my healthcare knowledge to that organization and to make things a little bit better. One of the things that we as nurses have been really pushing is to try to get nurses to serve on the Nurses on Board Coalition campaign as well. Their goal, as you know, was to improve the health of communities and the nation through the Service on the Nurses on Board campaign and other bodies. And one of the main aim of this initiative was to reach 10,000 boards and have those seats filled by nurses in 2020. And I am proud to say that we were successful and met that goal. Actually, Nurses on Board recorded more than 10,200 nurses who are serving on boards across the country. The great idea about that is that we were able to use our voices as nurses, and even myself as president of ANA, representing the nation's 4.3 million registered nurses. It's important that we're able to use our voices and have our say and get that out there. Obviously, one of the things I would encourage you to do is you need to stay up to date on the latest nursing trends in the healthcare news. It goes hand in hand with our ability to, to be able to speak with authority when you can say the most recent data or quote the most recent healthcare report that may have come out. I would also encourage you to find a mentor, and we'll talk a little bit more about that in just a little bit more in the presentation, but find a mentor and also be a mentor is so extremely important to do that as well. And one of the most crucial things, don't be afraid to ask questions. You may be asking questions that someone else is thinking, but they are afraid to bring to the forefront. So it's extremely important that you do that. Just know that to be a leader, you must also be an advocate and a role model as well. And I am proud to say that ANA has a very rich history of advocacy for more than 120 years, from women's suffrage to standards for education and practice, to supporting legislation for Medicare and Medicaid, to protecting the economic and general welfare, to shepherding the code of ethics with interpretive statements, to codifying our social policy statements, to creating a nurse credentialing agenda for the nation. ANA has been serving nurses, the public, and the profession. And just to point out a couple of things, on the bottom right, you see past President Joe Eleanor Elliott shaking hands with then President Johnson at the signing of the Public Health Service Act. And you know, one of the great things that came out of that particular act is the Title VIII, which again helps with nursing education. To the bottom left, that handsome guy there with President George Bush, that's me getting recognized for service during 9/11. The top right is this is when I met with President Trump in March to urge the administration to provide a sufficient supply of appropriate PPEs to nurses. ANA was among 12 other nursing organizations that was attending this White House meeting. And then the upper left, of course, is past President Karen Daley, as she is meeting with President Clinton in 2000 at the signing of Needle Stick Safety and Prevention Act. And I'm proud to say that ANA is now working with the Biden administration and Congress on advancing the profession of nursing as well. ANA believes that advocacy and leadership is a pillar of nursing. Nurses strictly and instinctively advocate for their patients in the workplace, in the community, but when it comes to legislative and political advocacy, that is no less important to advancing the profession and healthcare. And I hope that you will remember that. If there's ever a time when our advocacy skills were tested, it was last year in 2020. ANA increased its credibility and visibility in Washington, D.C. during that very critical time. We made a vital impact on shining the light on the shortage of PPE and COVID-19 tests and how healthcare disparities contributed to the disproportionate burden of disease and death in communities of color. We continue to monitor regulatory changes in states impacting nurses during the declared emergency, allowing nurses and others to review state responses and to act accordingly. And also, I would encourage you that for the latest information regarding that you follow us on our blog and at RN Action or on Twitter. But together, we have been amplifying nurses' voice. As the pandemic continued and we got the COVID-19 vaccines, again, since the emergency authorization of the vaccines in December, ANA has gradually shifted our focus to state and national efforts to get all Americans vaccinated. Many of us volunteered to vaccinate people in our communities and on our own times, sometimes coming out of retirement to do so. I know I have participated in 4 weekly vaccine clinics, including one at my alma mater, North Carolina Central University, where I was also enrolled as a student and encouraged other students to enter the nursing profession. In addition, I participated in clinical trials for the Moderna vaccine and beginning last September at the University of North Carolina at Chapel Hill. And it was an honor to represent nurses, middle-aged adults, as I like to call myself, and people of color in this vital research. And I've shared this gratifying experience with the media at many speaking opportunities, striving to persuade others that the vaccines are safe. Again, taking on that leadership role and letting people know that when nurses speak, the country should be listening. And with mounting evidence of the vaccine's effectiveness in the current state of increases in the COVID-19 infection, hospitalizations, and deaths, and increasing the circulation of the new variant and lagging vaccination rate, it is important that we do whatever we can is key to ending this pandemic. Nurses have a professional and ethical obligation to model the same healthcare standards that we prescribe to our patients. Earlier this week, I'm proud to say that ANA released a statement supporting healthcare employers mandating nurses and all healthcare personnel to get vaccinated against COVID-19 in alignment with current recommendations and immunizations by public health officials. We must move from vaccine hesitancy to vaccine competency, and part of this is asking why individuals may not get vaccinated, but then also using our skills as a leader to point them in the right direction and to find the answers that they so badly need so that they can move from vaccine hesitancy to vaccine competency. We've also been very instrumental in educating the American public about the vaccines and administering them on a record time. ANA joined the Ad Council and the COVID Collaborative to launch the COVID-19 Vaccine Education Initiative, It's Up to You. I was part of a media tour with experts from other healthcare organizations to educate Americans about the vaccines. ANA partnered with the Centers for Disease Control and Prevention and the American Academy of Pediatrics on Project First Line, an initiative geared towards preparing frontline health professionals to protect themselves, their patients, and their communities from infectious diseases, including COVID-19. I also participated in a program called Count Me In. This is sponsored by COVID-19 Vaccine Education and Equity Project and provides education and vaccine outreach in communities of color. And then COVID Vaccine Facts for Nurses is a program that provides nurses with the crucial information that they need about administering the vaccines and counseling patients, in particular emphasis on communities of color. And ANA was also one of the founding members of the Department of Health and Human Services Community Corps and the Made to Save Coalition, which again reaches out to all communities and grassroots organizations to voice an opinion and to encourage people to get vaccinated. So these are just a few of the collaboratives that enabled us to work more effectively during this pandemic and to take on our leadership role as we serve as a reminder of the critical influences that nurses have in our community. Now, we know that the promise of a new normal, if you will, is in sight, but with effective vaccines and plenty of supplies, we have an opportunity as an organization now to reflect and recover. But when we do that, some of the questions we need to ask: what will change as a result of this whole, of what the whole profession or what we have just experienced? Will the nursing profession be made stronger? Will nurses continue to lead? What is happening in society that we want to change? Well, we're committed to tracking some of those changes and tackling those changes. And one of those changes is that of racism. Our code of ethics demand no less. As nurses, we accept and care for people as they are. We're taught to treat each patient with respect and dignity, regardless of their culture, their race, their religion, their ethnicity, their gender, their sexual orientation, their age, and all other aspects of identity. And we open our professional doors to nurses from all backgrounds. The reality, however, is that we have a lot more work to do before we can call ourselves a model of diversity, equity, and inclusion. To start, we need to clean our own house. We must acknowledge and apologize for segregation that nurses were subject to in the past. Eradicating racism in nursing starts with us. And I'm proud to say that last fall, ANA's board of directors voted to convene a steering group to explore racism in nursing and create a national action plan to guide diversity, equity, and inclusion efforts within the profession. The National Commission to Address Racism in Nursing emerged. The commission is led by ANA, the National Black Nurses Association, the National Coalition of Ethnic Minority Nurses Association, and the National Association of Hispanic Nurses. The commission is facilitating national discussions about experiences of nurses of color and the impact of systemic racism. Out of those discussions, we will develop an action-oriented strategy for change. Currently, members are creating education, practice, policy, and research work groups and hosting listening sessions with nurses about the racism that they have encountered in the workplace. By lending national discussions within the nursing profession, the commission aims to own, amplify, understand, and change how racism negatively impacts colleagues, patients, families, and communities, as well as the healthcare system. I encourage nurses to become role model of anti-racism for other professions to follow. And we must be intentional and do more to bring in more minorities and men into our profession. Now, this year is a historic year for the American Nurses Association as we celebrate our 125th anniversary. And I might add that it is the 30th anniversary of the American Nurses Credentialing Center. Over the years, we have had the privilege of serving nurses through our work to advance and elevate the profession, to improve work environment, and to strive for the public good. As we and as you, graduates of this program, begin to navigate your leadership journey, I want you to know that ANA is there to help you. Despite the difficulties that we're facing, ANA encourages you to make the year of the nurse your year, and also that you seek opportunities and engage in activities that promote nursing excellence, that infuse leadership, and foster innovation. Share your experience, take on leadership roles, focus on your physical and mental health. ANA has developed a series of essential leadership resources geared towards a variety of nurses. Whether you're a nurse interested in excelling in a career path, or a leader within the healthcare organization who represents the interests of the nursing profession, or a seasoned nurse or healthcare administrator interested in refining skills to differentiate them from competition or to achieve the next level of leadership. We have a pipeline of professionally developed programs that draw on evidence-based practices and multidisciplinary approach to build, develop, enhance, and grow your leadership impact. All of the programs are developed on a foundation of competency reflected in our competency model framework based on quality, safety, and evidence. So from a vast selections of webinars to an assortment of leadership books, we provide you with the skills and strategies you need to become an effective leader. Some of our resources are even offered as a bundle for your convenience. Our online communities are designed to give nurses a personalized experience built on networking and encourages you to seek advice and feedback from fellow nurses. Discussion boards are available for a range of careers and stages. All of these are important as you begin your leadership journey. And finally, our Career Center gives employers instant access to qualified nurses working in all areas of healthcare. Employers post nursing jobs regularly to search our database, and they recruit ANA members who represent the top talent in nursing profession. So get started today by posting your resume, since you're graduating now, setting up a job alert to learn about job openings in your specific area, and gain access to our directory. We also invite you to join your peers and to have a resource for asking questions, for bouncing ideas, and for sharing your experience and your expertise through our career communities, which are defined as the early career. This is for RNs who've just graduated within the last 4 years, and that they're striving to learn a little bit more about nursing and how to overcome the stress and the challenges of working day to day and to take care of your patients. If this describes where you are in your career, then the early career community is the resource that you need. You connect with staff nurses going through the same issues that you are, and will gain insights into steps to take as you move forward, including the possibility of going back for even more graduate education. And then there's the up-and-comers. This community is for RNs with 5 to 14 years of experience. If you're highly passionate about nursing and about leadership and planning to become a leader within the profession, then this community is for you. Connect with other RNs just like yourself who are beginning to navigate the path of career transition, perhaps into education, advanced practice, or management position, as well as pursuing or planning to pursue an advanced degree. And then there's the nursing leaders as well. ANA invites all nursing leaders to join this online community. This community is the place for nurse executives, APRNs, and nurse professionals or nursing professionals who have more than 15 years of experience to connect with their peers. Again, another way to use your leadership skills to serve as a mentor. So as I mentioned earlier, mentorship is a key component of expanding your knowledge base and leadership skills. So our membership programs add important values to being an ANA member. Early career nurses desperately need and want more experienced nurses as job mentors. And those with more experience, who we call the up-and-comers, nurses who are looking for career mentoring from high experienced nurses, while our nurse leaders may be interested in mentoring the next generation of nurses. We work to align the mentors and the mentees within the same state so that we can and we will continue to learn more about their program and who they are and what they do. So I strongly encourage you, again, as you graduate this evening and begin to spread your wings, that you also consider that you need to reach back and bring those that are coming behind along in that particular realm as well. And also, please stay engaged. Follow us on Twitter or at RN Action, or the ANA President at ANA President, or at ANA Ethics. You can also follow us on Facebook, and you can also stay up to date on ANA's policy work through our Capitol Beat blog as well. So with that, I will say thank you for the opportunity to provide this keynote, and also congratulations to you for completing your work. And I look forward to seeing and hearing great things from you. Thank you.
Thank you so much, Dr. Grant, for that address. And for your leadership, all that you've been able to do with the ANA in your tenure as president, the programs that you mentioned this evening, and some of the initiatives that you've even been very instrumental in starting. We're just grateful to have you and your leadership, and so we appreciate that.
Thank you, Dr. Bonner.
Yeah.
I'm happy to say too that Dr. Bronner is a major contributor to the the Commission to Address Racism in Nursing, and she has just been phenomenal. And I'm excited that you are continuing to go down this journey with us.
Oh, wonderful. Thank you. It has been an honor. And that is actually one of the first questions that we have in the chat from Dr. Gibson. And she asks, how can we support and or participate in the National Commission to Address Racism in Nursing?
That is an absolutely great question, and thank you very much for asking. There are no more room, I guess you could say, for actual commission members. We have 46 members on this particular commission, so you can imagine whenever you're trying to discuss an idea, you have 46 different opinions multiplied times probably 46 again. However, there is a role that we are asking nurses to play. There's a potential, as I mentioned, the work groups are divided into education, clinical practice, advocacy, and research. If you have an expertise in that particular area and would like to perhaps serve on one of those work groups, that is one opportunity. There's another opportunity as well, is that once the final document is completed or near completion, it will be sent out for reviews as well. We're looking for nurses to review and offer comments. Again, sometimes you can't see the forest for the trees, so this is a great opportunity for someone who has, who is working in this area regularly and on a daily basis, to be able to offer some comment as well. So those are the couple of opportunities that are there. And if someone is interested in possibly serving on one of the work groups, then you can either get in touch with myself or Dr. Bronner, and we'll be happy to point you to the co-chairs that are overseeing those work groups. Let me just take a moment to say with those, the reason we decided to do those 4 particular areas is that, first of all, we knew that it starts, racism starts with education. And, when a student nurse goes into a nursing program, just like a baby that is born, a baby is not born being prejudiced. This is something that is learned. They either get it through some of the textbooks that they have, i.e. through some of the stereotypes that may be displayed or written about. So we need to address it at that particular point with the hopes that it will change the NCLEX exam, it will change the textbooks as well, and we can have those critical discussions. And then we move on into clinical practice, where it really takes root, because when you're on a nursing floor and you're a new nurse, you sometimes don't want to or do not feel empowered to speak up. So you let the culture of that unit that has always perhaps exacerbated racism in so many different ways, you suddenly find yourself blending in because you don't want to be, quote unquote, a rebel rouser. But one of the things we're hoping is that we can begin to address that at that particular behavior. Also, looking at the policies that an institution may have, whether it be conscious or unconscious bias that may be there, again, calling those into question as well. And the same thing when looking at research and looking at advocacy as well. So the whole idea is that by addressing these and putting them in the format of ANA's scope and practice standards, then organizations like the NLN, when they go to accredit a nursing program, they can say, we've adopted these standards, show us how you have incorporated that into your program. When the Joint Commission goes to accredit a healthcare facility, the same thing. We've adopted these standards. How are they implemented throughout your institution as well? So that's what's going to be the driver of change. And we know that this is going to be a living document. It's not just going to be a one and done. It will be a living document and be updated every 3 to 4 years or so. So that's where the change is going to begin to happen, or what we see that is happening.
Yes, thank you for that. And we had a suggestion in the chat saying that for the hospitals to maintain their magnet status,
right,
that you have to comply with that. So I think we have some very interesting policy work, that can come down the line as we move forward.
Absolutely. And the folks at Magnet are beginning to change their criteria as well to specifically address this. So this is a perfect time that that the commission has been formed as Magnet begins to change their guidelines and their pillars, if you will, so that again it does address racism as also.
Absolutely. And then I just want to note, Cheryl Peterson, who's on staff with ANA, has her email address in the chat. So for those of you who are interested in connecting with the commission, you can email her at cheryl.peterson@ana.org. And her first name is CHERYL to connect with her. We did have another question coming in.
Excuse me, Dr. Grant, thank you so much.
You're welcome. Anytime.
Okay. Our next question, are there any plans for the ANA to address how the current healthcare crisis related to COVID is impacting nurses? So thinking about the shortage, fatigue.
Yes, actually, we have been doing, lots of interviews, you know, with the media, putting word out there about the shortage, trying to, you know, for nurses who may have left the profession, trying to encourage them to come back and et cetera. But we also have been having meetings with other organizations such as the American Hospital Association, the Organization of Nurse Leaders, to try to strategize what can we do to not only retain the nurses that are there, but also prevent nurses, you know, from leaving. If you're listening to the news of late, you know, the biggest thing now is that a lot of nurses are wanting to, you know, they're tired, they're frustrated, they literally are burnt out. But what is enticing them to stay is that they're realizing I can become a traveler and make 3 to 4 or maybe 6 times the hourly wage that I'm making now. So if I'm going to be tired, I might as well be rich and tired. The bad part about that is, of course, they leave and they take the skills that they have with them to the next hospital, and it leaves the institution that they just left very short-staffed. And we've got to put in place some way to address those issues. It is a workforce issue. It is a shortage as well, but we need to be able to come together and strategize what can we do. And one of the biggest concern is for the nurse who remains at that institution. You know, they're saying, I'm being loyal, but yet I'm not being rewarded for that loyalty. Or you're bringing in someone that you're paying, you know, 4 to 5 times the salary that, you know, that I'm getting. You know, what about me? You know, so those are some very strategic questions that we are trying to tackle and trying to find answers for. We know that nursing schools are not going to be able to turn out enough nurses to meet this shortage that we have. And we also know that it takes the nurse a good, you know, 1.5 to 2 years before they really feel competent, you know, on the floors that they are on. And from what I've heard, new graduates from last year, a lot of them had their preceptorship cut short because they were quote unquote needed in staffing. And I'm encouraging CNOs to go back and make sure that their preceptorship has been restarted, because they may have learned behaviors that are wrong. And what they don't know is they don't know what they don't know. So, you know, so they're doing something that is constantly perhaps working for them, but it may be wrong. So those are a lot of things that we're trying to address, and also having discussions with the Department of Health and Human Services as well, as far as trying to get some funding that would help us to you know, help those nurses who are remaining at the bedside. We have been pushing for hazard pay for you know, for nurses throughout this whole pandemic, and it seems to be falling on deaf ears, but we're continuing to do our best.
Great. And we have about 2 minutes left, so I'll try to get this one last question in. Where faculty continue to be underpaid, making it difficult to recruit and retain diverse faculty. Do you have any thoughts or work from the ANA in this area?
Yes, once again, still working with you know, with other organizations to bring up faculty salaries, and you know, trying to get members of Congress to recognize that in order to put more nurses there, you know, into the workforce, we need more nursing faculty. So yes, bringing up their salaries, you know, lightening their teaching loads, increasing skills labs and et cetera, so that again, they can use those as a tool and et cetera. All those are things that we're working on as well. And it is a very, very slow process. Believe it or not, when I started at ANA about 3.5 years ago, my hair was all black. So you see what has happened during this time. So, but thank you very much for that question. But we are definitely working as hard as we can to try to meet those needs.
All right. Well, thank you so much, Dr. Grant, again, for your time this evening, your words of wisdom and inspiration. We truly appreciate it.
Oh, well, thank you. And good luck again and congratulations to the graduates and the award winners. It was indeed an honor to be with you this evening.
Yes. And then so for those continuing on in the conference, we're about to have a break from 7 until 7:15. And so please use that time to go into the virtual conference platform. And if you click on Activities Lounge, you can go to the photo booth, look in the Health and Wellness Suite. There's lots of fun things that you'll be able to check out there, as well as networking with the graduates, the alumni, the NAC members, everyone who's on. And so, for 7 to 7:15, we'll be on break. Check out the online virtual platform, and then we'll be back here at 7:15 to celebrate our graduates. So we'll see you all in about 15 minutes.